meeting of the Integration Joint Board Clinical and Care Governance Committee. First of all, do we have any apologies?
There was an apology from Roger Whitley this morning.
Okay, thank you. Any other apologies? No. Good morning, Stephen.
Good morning. So it popped. I don't know what happened there. The Teams meeting popped through on my phone. I was trying to correct it.
That's okay.
Yes. Good morning.
Right. Good morning. So we'll just begin. Do we have any declarations of interest? No. Gordon, yes.
Sorry, Chair, my hand was up to give an apology on behalf of Lindsay Bonella from the NHS Patient Relations. She's just recently been appointed as the Patient Relations Manager, and unfortunately she's not able to make the meeting this morning. That could be noted. Thank you.
Okay, thank you, Gordon. Okay, back to declarations of interest then. No. So we'll go to the minute of the meeting of the 24th of March. Can we agree that as a correct minute? Yeah, agreed. And are there any matters arising? Anything anyone wants to raise about the minute? No. Okay, in that case, we'll go on to the action log. So we have, I think, everything either dealt with or on the agenda. Anyone want to raise anything about the action log? Nope. Oh, we could get through this quickly today at this rate. Right, so going on to agenda item 5, the overview local oversight arrangements. That's a report by Suzanne. So if you could, Suzanne Thompson, give a summary of that, please.
Thank you, Chair. Morning, everyone. The report provides committee with an overview of a range of groups that work across the partners and services, and they're relevant to the health and social care partnership, so they're included in this report. The report itself intends to provide assurance to the committee of appropriate levels of oversight and scrutiny that's taken place, and committee are aware of this as a standing agenda item. In terms of the report itself, at section 4, we've provided a summary of the Public Protection Chief Officer Group's meeting held on the 15th of March and the items that they considered at the meeting. These include a refreshed terms of reference, which we've attached to Appendix 1 to the report. The risk register and insurance statement and report was also discussed. 4.8 of the report highlights the areas of risk noted in relation to the workforce, Adult Protection Committee and Child Protection Committee risk register work that's ongoing, mental health and wellbeing and gender-based violence. At section 5 of the report, we've provided an update on the reports considered by NHS Forth Valley Clinical Governance Committee at their meeting held in February, and this is detailed in the table at 5.4. The agenda items considered by the Clinical Governance Working Group at their meeting in March are also set out at 5.6 for committee's information. Care home assurance activity continues, including resident reviews with all residents in Falkirk care homes receiving a review, and a continued focus to ensure these reviews are completed seamlessly for all residents. These particularly include welfare guardianship reviews where the council is the guardian. The work of the Adult Protection Committee and the Alcohol Drug Partnership are set out at sections 7 and 8. Work has been progressing to review the ADP structure, and it's anticipated this will be in place by the autumn. The ADP annual report has been considered by the ADP Committee and the Health and Social Care Partnership Senior Leadership, and will be presented to the IJB at its meeting next week for approval and submission to the Scottish Government. Due to a vacancy in the Strategic Prevention Coordinator post for suicide and substance use deaths, a more detailed update will be presented at a future meeting. However, momentum has been maintained with the drug-related death review process, so that work has continued. A new group has been added to this report, and that's the Health and Social Care Partnership Health and Safety Management Group. This group was established last year and has met monthly since November through to March this year, and we're now moving to a quarterly reporting meeting structure. The purpose of the group is to scrutinise our health and safety arrangements and performance, providing assurance to the senior leadership team. The group is well attended by a range of managers across services, and we are well supported by our health and safety advisors and our fire risk advisors. The group has considered a range of reports, including adverse events, training compliance, fire risk assessments, and our control book audits. So in conclusion, the report summarises the work of various groups since the last update we provided to committee, and committee is asked to consider and comment on the report as noted in the recommendation at 2.1. I'm happy to take any questions.
Okay, thank you, Suzanne, for this thorough report. Does anyone have any questions about the report or any comments they want to make? In that case, we are moving fast, aren't we? We have considered and not made comment on the report. So thank you very much for that, Suzanne. We move on to agenda item 6, inspection reports, and I think that's you again, Suzanne.
Thank you again, Chair. The report provides an update on inspection reports published since the last committee, and it also provides an update to committee on the NHS Forth Valley escalation arrangements. There has been one care inspector inspection, and this was for our MEC service. It was an unannounced inspection that was held in January, and at the time of the inspection, over 3,000 people were being supported by the service. The inspection considered 2 quality indicators assessing against a 6-point scale. So in relation to how well do we support people's well-being, this was assessed as good on all 3 subsections of that indicator. And how good is our leadership quality indicator was also assessed as good with an overall score of good. There was one area of improvement identified in relation to ensuring effective reviews of care plans take place at regular frequency, and that's voted at 4.8. Work continues obviously to address that issue. Section 4.9 and 4.12 provides an update on NHS Forth Valley escalation and includes appendix to published reports on the NHS Forth Valley website. The report also notes there were no Mental Welfare Commission reports published in the period. So in summary, the committee is asked to consider and comment on the report as noted at 2.1 in the report. Thank you.
Okay, thank you very much. I'm very pleased to see the next inspection came out so well. That's well done, next. I was supposed to be attending a meeting there to see the work, but unfortunately I was unable to do it. So I hope to organise that on another occasion. Does anyone have any questions about the report? Or any comments? I think it's obviously a really important report giving us the details of the inspections. Glad to see everything's going well though at the moment, and glad to hear that the one issue raised is being addressed. Okay, but everybody seems to be keen to move on. Is it the weekend coming that makes us want to move? Right, on to agenda item 7 then, please. That's the Health and Social Care Partnership complaints and feedback for January to March 2023 performance report, and I think that will be you, Gordon. Yes, good. If you would let me just please.
Thank you, Chair. Just searching for the button to get the mic on again. Thank you very much. So, committee will be familiar with the format of this report. I will go over the social work adult services part of that. As I said earlier, Lindsay gives her apologies. She's just recently started and didn't have the meeting in her diary, so she's unable to attend today. But I did say I'd give apologies and take back any queries to her to follow up with the committee on this occasion. Looking at the social work adult services part of the report to begin with, at table 4.3, you'll note that the improvement, the percentage of complaints completed within timescales has improved in the last quarter. Committee might remember the previous couple of quarters, the performance had dipped quite markedly. That was obviously a disappointment, but we've done some work with managers within the service and we've got it going back on an upward trend again. Overall, the performance for this year is down on last year, which again is a disappointment, but the fact that we've turned this around and it appears to be going back in the right direction again is encouraging. It shows that with focus it is possible to raise the performance level over the last 3 years, as you'll see in table 2 below. Sorry, not table 2, table sorry, I've lost my, yes, table 2 below. The performance was 56% in 2021. We improved to 77% in 21-22, but last year, taking into account the dip there was in quarters 2 and 3 in particular, we fell back again. Hopefully we're back on an upward curve and we'll be able to sustain that performance going forward. Stage 2 performance has been fairly steady over the previous quarters. The numbers are very small. There was one stage 2 complaint which we didn't manage to get done within timescales, hence the drop. But overall, the stage 2 performance standard has been pretty good. I'm less concerned about that, though obviously we want to do our best to ensure that all complaints are dealt with within timescale. A new feature in the report this time is about the implementation of care opinion. This is something that NHS has had for some time and has been recently introduced for use in relation to social work adult services, actually from April this year. So the time periods are not the same, but hopefully we'll have more detail on how that is going in the next report. But as you can see in the report, we've already had some comments, some positive comments coming through that, which I'm sure will help. Both positive and negative comments will help us as we look at improving services overall. Turning to the NHS Forth Valley section, you'll see the details are there. As I said, I'm happy to take any queries back to Lindsay and provide feedback on those to you in due course. I'm happy to take any questions. Thank you.
Okay, thank you for this important report. I always think complaints is perhaps not the best word to use, because it's complaint sounds bad, but in fact it's important because no service is perfect, and it's important that we are learning from the comments that we're getting back from our service users. I wonder if you would like, first of all, though, just to say a wee bit about the areas where there has been that reduction and about the reasons behind the reduction in performance in terms particularly of the stage 1 complaints and table 2.
Yeah, of course. Stage one complaints have a turnaround of 5 days, effectively 5 working days, and over quarter 2, quarter 3 of 22-23, we saw that that position was deteriorating. There wasn't a specific team. It wouldn't be appropriate to highlight individual teams anyway, but we saw a general decline in performance. I think it was partly to do with the increasing number of complaints coming in. There had been a reduction in complaints over the period of where the pandemic was most acute. The number are increasing again, and the workload has significantly increased across all the teams, and it's about trying to ensure that managers keep the complaints as close to the top of their priorities as they can. But with the amount of work that's coming in through the teams, it's quite difficult to judge. So some sympathy for the manager, a lot of sympathy for the managers in trying to juggle that. And with the tight timescales, it can be difficult. Literally a couple of days can make a difference between getting a complaint in time or not. So there wasn't a specific area where I felt that the complaints were not being responded to more than others. It was more widespread than that. As I say, we've kind of, well, we have reiterated the messages from senior management about the need to get those complaints responded to within timescales, and that reminder and a constant reminder through supervision and other meetings that we have to managers has obviously helped to bring that or keep that higher up in their agenda.
Okay, thank you, Gordon. We'll look forward to seeing an improvement then, hopefully. Margot.
Yes, just to commend the work of Care Opinion and its value in reassuring service users that any concerns are investigated while preserving their own anonymity and really preventing something from becoming a complaint in many cases. So I'm very pleased that it's included and look forward to hearing in future meetings about its success. Thank you.
Thank you, Margot. I think we would all echo that that sentiment. Any other questions or comments? No, in that case, we will. We have considered and commented on the content of the report. So thank you. We'll move on now to agenda item 8, the Healthcare Acquired Infection Performance Report, January to March 2023. Again, a regular on this agenda. And this is yours, I think, Suzanne?
No, it's Jonathan.
It's Jonathan.
Yeah.
Sorry about that, Jonathan.
Okay,
Apologies.
thank you, Chair. Thank you, Chair. Good morning, everyone. So yes, as I said, this is the quarterly report for between January and March. But what I'll do as well, I'll give you just a bit of an update on what's going on now, since we're quite into the next quarter as well, if you don't mind. Okay, just very quickly on COVID, where we are. Within the first quarter this year, we did see a rise in our COVID numbers, certainly at the end of January and the beginning of February, where we saw across Scotland a new variant of COVID, which was more transmissible. So we did see that, and we did peak in our inpatient numbers to the mid-60s, and towards the end of the quarter we saw quite a decrease down to about 25 inpatients on average per day towards the end of the quarter. Subsequently, the weeks following that, numbers have since reduced quite dramatically, and just for as of today, we've got 2 patients with COVID across the hospital sites across Forth Valley. So just gives you an indication where we are now with our COVID numbers, which is very, very good. Moving on to care homes, I did say at the last meeting that I was hoping to present some greater detail into the care homes. We did have a bit of a delay in that, in terms of getting how we get the data integrated within our current systems, and also how we then can extract that. It needed the assistance of another department, our information services department, to extract the data from our system so we can actually represent that. So we have done that now, and we're in the process of last month we've increased our whole-time equivalents to 1.8 whole-time equivalents now supporting care homes, and we're in the process of finishing up a second tranche of all care homes being audited and assessed for standard infection control precautions. And from that, we're going to we'll be able to do a deep dive into some of the proactive work that we'll need. So we're looking at things like patient, resident care equipment and things like that. And so things that are highlighted, common themes, we can then target our focus on particular care homes and also particular themes as well. So we can actually do some bespoke training for care homes and so on. So all going come next, and that the initial report of my findings was presented to the Care Home Assurance Group, I think a couple of weeks ago now. So we're anticipating this deep dive will be presented there in the coming next week or so. Once we get the 2 lots of audits performed. So going forward, I'll be able to include greater detail of specific care homes relevant to this IJB, and so give you some insight of the situations at play there.